Syeda is a combination of two hormones, estrogen, ethinyl estradiol, and progestin, drospirenone. It is used to prevent pregnancy. In addition to preventing pregnancy, it may also make your periods more regular, decrease blood loss and painful periods, and decrease your risk of ovarian cysts. It's important to note that using this medication does not protect against sexually transmitted diseases. It's best to take Syeda at the same time every day, with or without food. It's important to follow the package instructions to find the first tablet. Start with the first tablet in the pack, and take them in the correct order. Be sure to ask your doctor or pharmacist if you have any questions. Before you start using Syeda, make sure to read the patient information leaflet provided by your pharmacist. This leaflet contains important information on when to take your pills and what to do if you miss a dose. Take this medication by mouth as directed by your doctor, with or without food, usually once daily. It's best to pick a time of day that is easy for you to remember and take your pill at the same time each day, 24 hours apart. Taking this medication after your evening meal or at bedtime may help decrease stomach upset and nausea. Make sure to follow the package instructions to find the first tablet and take them in the correct order, without skipping any doses. If you experience vomiting or diarrhea, you may need to use a backup birth control method, such as condoms or spermicide. Your pill pack contains 21 pills with active medication and may also contain 7 reminder pills at the end of the pack. Take one active pill once daily for 21 days in a row. If you are using a product with 28 tablets, take a reminder pill once daily for 7 days in a row after you have taken the last active pill unless otherwise directed by your doctor. If you are using a product with 21 tablets, do not take any tablets for 7 days unless otherwise directed by your doctor. If this is the first time you are using Syeda and you are not switching from another form of hormonal birth control, take the first tablet in the pack on the first Sunday following the beginning of your menstrual period or on the first day of your period. For the first cycle of use only, use an additional form of non-hormonal birth control for the first 7 days to prevent pregnancy until the medication has enough time to work. Consult your doctor for more information on how to switch from other forms of hormonal birth control to Syeda. Some common side effects of Syeda include nausea, vomiting, headache, bloating, breast tenderness, swelling of the ankles/feet, and weight change. You may also experience vaginal bleeding between periods or missed/irregular periods, especially in the first few months of use. If any of these side effects persist or worsen, it's important to inform your doctor. Syeda may also raise your blood pressure, so it's essential to monitor your blood pressure regularly and notify your doctor if the results are high. Serious side effects that require immediate medical attention include unusual changes in vaginal bleeding, symptoms of high potassium blood level, and potential problems from blood clots. Seek medical help right away if you experience any very serious side effects, such as lumps in the breast, severe stomach/abdominal pain, dark urine, yellowing of the eyes/skin, mental/mood changes, or signs of a serious allergic reaction like rash, itching, swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. If you're a smoker and over 35 years old, you should not use Syeda. This is because smoking can increase the risk of serious health problems such as stroke, heart attack, blood clots, and high blood pressure when using hormonal birth control like Syeda. The risk of these problems increases as you get older and smoke more cigarettes. It's important not to smoke or use tobacco while taking Syeda. Before using Syeda, it's important to talk to your doctor or pharmacist about any allergies you may have, as the product may contain inactive ingredients that can cause allergic reactions. It's also important to discuss your medical history, including any issues with adrenal glands, stroke, blood clots, high blood pressure, cancer, diabetes, heart problems, kidney problems, liver problems, or any recent or upcoming surgeries. If you have diabetes, it's important to monitor your blood sugar regularly and inform your doctor of any changes. You should also let your doctor know if you'll be having any major surgery or will be confined to a chair or bed for an extended period of time, as these conditions may increase your risk of blood clots. Before having surgery, make sure to inform your doctor or dentist about all the medications and products you use. Additionally, it's important to consult your doctor or pharmacist before using potassium supplements or salt substitutes that contain potassium, as Syeda may increase your potassium levels. It's important to limit your time in the sun and avoid tanning booths and sun lamps while using Syeda, as it may cause blotchy, dark areas on your face and skin. If you are nearsighted or wear contact lenses, you may experience vision problems or have trouble wearing your contact lenses, so it's important to contact your eye doctor if these issues arise. After stopping birth control pills, it may take longer for you to become pregnant, so it's important to consult your doctor if you're planning to conceive. Syeda should not be used during pregnancy, and if you become pregnant or think you may be pregnant, it's crucial to inform your doctor right away. Additionally, if you are breastfeeding, it's important to consult your doctor before continuing to breastfeed while using this medication. It's important to be aware of potential drug interactions with Syeda, as they may change how your medications work or increase your risk for serious side effects. Always keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Syeda may interact with certain medications such as aromatase inhibitors, atazanavir/cobicistat, fezolinetant, and others. It may also raise your potassium blood level, so be sure to inform your doctor if you are regularly taking other drugs or products that can also raise your potassium level. Some drugs may cause hormonal birth control to work less effectively, which can result in pregnancy. It's important to discuss any new medications with your doctor and whether you should use additional reliable birth control. Also, be sure to inform your doctor if you experience any new spotting or breakthrough bleeding, as these may be signs that your birth control is not working well. Additionally, this medication may interfere with certain lab tests, potentially causing false test results. Be sure to inform lab personnel and all your doctors that you are using Syeda. If someone has taken too much Syeda and experiences serious symptoms like passing out or difficulty breathing, it's important to call for medical help immediately. In the US, you can call your local poison control center at 1-800-222-1222. In Canada, call your provincial poison control center. Symptoms of an overdose may include severe nausea and vomiting, as well as sudden or unusual vaginal bleeding. Remember, Syeda is a medication that should not be shared with others. It's important to have regular physical exams while taking Syeda. This may include lab tests to check things like your potassium levels and blood pressure. You should also have breast and pelvic exams, as well as pap smears. Be sure to follow your doctor's instructions for examining your breasts, and report any lumps right away. It's important to keep all medical and lab appointments and consult your doctor for more details. When taking Syeda, it's important to follow your doctor's advice about when to take it and how much to take. This medication is typically taken once a day with or without food. Be sure to take it at the same time every day to help maintain its effectiveness. If you miss a dose of Syeda, refer to the product package information for advice on what to do next. You may need to use backup birth control, such as condoms or spermicide, to prevent pregnancy. If you have any questions, it's best to ask your doctor or pharmacist for guidance. If you often forget to take your pills as directed, it's important to contact your doctor to discuss switching to another form of birth control. When storing Syeda, make sure to keep it at room temperature and away from light and moisture. It's important to store it in a place that's out of reach of children and pets, and not in the bathroom. When it comes to getting rid of any unused or expired medication, it's best to consult your pharmacist or local waste disposal company for the proper way to dispose of it. Remember not to flush it down the toilet or pour it into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.